Hi, this is Dr. Preeya Gupta today here with Interventional Mindset, and we're going to be talking about a really important topic, which is how do you handle the patient who's had an MGD in office treatment that might not be completely satisfied. We know that there's many different procedures that are out there for MGD. I certainly have been doing them for the last 10 years, and it's can be a very difficult position for the clinician when a patient comes back to clinic after an MGD treatment and feels whether it's underwhelmed or just unhappy with the outcomes after their procedure. So today I have some pearls and tips on how to avoid this situation and how to manage it in the best way. We all know that dry eye is a multifactorial disease. MGD is one part of that puzzle, so to speak. And I think that it's really important to set expectations with our patients on what they should really expect, not only from their disease, but also what they can expect from these in-office treatments. So first, I like to set realistic expectations by reviewing my biography with patients. So when they come in, patients that have mild gland dysfunction and mild atrophy of their meibomian glands, in my own clinical experience, I've found that those are patients that actually respond better to these in-office treatments. And it's not surprising. Those are patients that have more glandular tissue, more glandular function. And so it's easier to restore the function to an appropriate level when they have just mild atrophy. Patients with moderate to severe atrophy, unfortunately, have lost a lot of their glandular tissue. And that really, puts the patient at a disadvantage, but it also puts these in-office treatments as a disadvantage. It becomes much harder with less tissue to revive to increase the tear breakup time, which really is required to improve the patient's symptoms. So patients with moderate to severe gland atrophy, I like to show them their picture, and I like to set the expectation that one single therapy is not going to cure or control their disease, and that they are in the bucket of patients that are likely going to need more than one therapy, or polytherapy as I like to refer to it. This allows the patient to understand and really allows them to make an informed decision on whether or not the financial outlay kind of is worth it to them. When I also talk to the patients, I also like to objectively have some measurements that I do before I proceed with any treatment. So we measure the tear breakup time and then also assess their symptomatology using a questionnaire. Commonly, we use the OSDI or the SPEED questionnaire. This allows us to level set kind of at a pre-treatment level and say, this is where you are today. I hope that your tear breakup time improves. I hope that your symptomatology improves. And this allows the patient to kind of have a benchmark to compare themselves to when they come for their follow-up visit. I usually assess patients about 2 months after the treatment because I do find that while relieving the obstruction happens, at the time of the procedure, it does take the body some time to recuperate and to start producing a healthier oil. So at that follow-up visit, we remeasure their tear breakup time and their symptomatology. And I review it with the patient. I ask them, how do they feel? And I try to characterize real world situations to them. So I ask them, can you use the computer longer? Can you read longer? If they're a contact lens wearer, I ask them, are you wearing your contacts? And patients sometimes forget that they're doing these more, quote unquote, normal activities that they weren't doing before the treatment. And I feel like that also helps them to understand where they might be gaining an improvement. The next thing that I like to do is when I set their expectations for what they should experience from the procedure, I like to describe improvement in two categories. There's the anatomic function of the meibomian glands, and then there's the symptomatology. In my own clinical experience, after many years, I do find that most all these procedures do improve the glandular function, so meaning that their anatomy improves. And I like to express to the patients that it isn't always that patients will notice an improvement in symptoms, but that I'm equally as satisfied if their anatomy improves. Because while there's the, here and now, my symptoms, there is also that future bucket, and that's really important. A lot of these patients that I'm seeing are young patients. They have many decades left to live, and I think it's important that we are addressing this disease process as early as we can, but also with the eye to the future so that we can prevent atrophy over time. As we all know that once the meibomian glands are atrophied today, in our current time, we don't have any tools or technology to revive or regrow the meibomian glands. So there is value in treating the glands so that there's less dysfunction in the future. And I think a lot of patients can really relate to that, and they understand that there's value in doing the procedure from a future perspective in addition to treating their current symptoms. So overall, I think it's just really important that you support your patient and that you act as someone that's on their team, because a lot of times when patients are frustrated, it's that they don't know what to expect, and they worry that they're going to be out there alone. Often these patients have seen multiple doctors and really just want relief of their symptoms. And so I think that if you can help your patient understand how the procedure is improving not only their symptoms but also their anatomy, and set realistic expectations so that they don't put all their eggs in one basket, so to speak. I think those are all very important pearls. And then, of course, let's not forget to also look for other comorbid conditions that we find in dry eye and MGD patients, such as ocular allergy, lifestyle issues like being on a computer for 18 hours a day. Those are all things that need to be treated side by side, not only just the MGD. So I hope you find these helpful, and I hope everyone adopts some MGD treatment in office. It's a very successful tool that we have to help improve our patients. Thank you.